Hello everyone. In this video we'll be talking about dentigerous cyst. So what is dentigerous cyst? Dentigerous cyst is an odontogenic cyst that surrounds the crown of an impacted tooth caused by the fluid accumulation between the reduced enamel epithelium and the enamel surface, which results in a cyst in which the crown is located within the lumen. So, first let us know what is reduced enamel epithelium. To know, first let us understand the enamel organ. So, enamel organ consists of inner enamel epithelium, stratum intermedium, stellate reticulum, and the outer enamel epithelium. When the enamel formation is completed, the enamel organ degenerates. The stratum intermedium and the stellate reticulum, there is degeneration. So the inner enamel epithelium and the outer enamel epithelium forms the reduced enamel epithelium. So in an unerupted tooth, we can see dentigerous cyst if there is accumulation of the fluid between the enamel space and the reduced enamel epithelium. So in this photograph we can see an impacted third molar in which there is a dentigerous cyst present. So dentigerous cyst is formed here by the accumulation of fluid between the enamel space, that is the crown of the tooth, and the reduced enamel epithelium. So fluid is accumulated here between the crown of the tooth and the reduced enamel epithelium. Now coming to the clinical features. So it is seen in the third decade of life. Most common site here is mandible. Mandible, especially the mandibular third molar area, is the most commonly involved site, followed by the maxillary permanent canine, mandibular premolar, and the maxillary third molar. So basically dentigerous cyst is seen in the second and the third decade of life with a male predilection. So clinically it is usually a painless lesion and is usually diagnosed when the patient has taken an X-ray. So in the X-ray what we can see? We can see an impacted third molar where there is a dentigerous cyst present. It is usually a slow growing swelling, usually painless. Pain may occur if it is infected. So there will be expansion of the bone. Which will result in the facial asymmetry. This expansion can result in the displacement of the tooth. There can be resorption of the adjacent tooth. So there will be hollowing out of the entire ramus. It can extend up to the coronoid process or the condyle. So due to the expansion of the bone, there is resorption inside, which will result in the eggshell crackling, or which is also known as frog belly phenomenon. So in this radiograph we can see a dentigerous cyst which is present on the crown of an impacted third molar. Here also we can see dentigerous cyst occurring in the crown of an impacted third molar. Dentigerous cyst is usually solitary. Sometimes bilateral dentigerous cyst or multiple cysts can be seen. So if it occurs in association with a number of syndromes, including the cleidocranial dysplasia or the Maddox-Lamy syndrome. Radiographically, three variants. First, central variants where the crown is enveloped symmetrically. Second pattern is the lateral type where we can see the dilation of the follicles on one aspect of the crown. The third type is circumferential. In circumferential crown we can see the entire tooth appears to be enveloped by the cyst. So they are basically the radiolucent areas which will be surrounded by a thin sclerotic line, which represents that there is some bony reaction. So now there is a confusion always whether that radiolucent area is a cyst or an enlarged follicle. So if the pericoronal radiolucency is greater than 4 mm, it should be considered as a dentigerous cyst. Any radiolucency greater than 4 to 5 mm should be considered as a dentigerous cyst, and the specimen should be sent for biopsy so that the final diagnosis could be found out. So what are the differential diagnosis? So the differential diagnosis can be odontogenic keratocyst, unicystic ameloblastoma, or adenomatoid odontogenic tumor. So before going to biopsy, we should take an FNAC. So in FNAC, we can rule out whether it is a vascular lesion or not. We can send the tissue for cytological preparation. So if dentigerous cyst is infected, the fluid will be suppurative, and if it is not infected, it will be a straw colored fluid. Now coming to the histopathologic features. Dentigerous cyst ka epithelium will be a thin layer of stratified squamous epithelium which will be lining the lumen. A thin layer of stratified squamous epithelium. The rete pegs are generally absent. The connective tissue is thin connective tissue which can be composed of loose fibrous connective tissue or of sparsely collagenized myxomatous tissue. So in the connective tissue we can see islands of odontogenic epithelium. Okay. Also the other things which you can see in the connective tissue is inflammatory cell infiltration and also the presence of Rushton bodies. So what are Rushton bodies? So Rushton bodies, they can be seen within the lining epithelium. These are peculiar, linear, often curved, hyaline bodies with variable stainability which are of uncertain origin, questionable nature and unknown significance. So the Rushton bodies, they are basically of hematogenous origin. Okay. Sometime we can see the proliferation of the epithelium. If the cyst is infected, we can see chronic inflammatory cell infiltration in the connective tissue. So what are the possible complications? So if the cyst has been treated, there is always possibility of recurrence due to the incomplete surgical removal of the cyst. So what are the complications? First complication can be ameloblastoma. So here the ameloblastoma can develop either from the lining epithelium or from the rest of the odontogenic epithelium in the wall of the cyst. So ameloblastoma, which is an odontogenic tumor, it can arise from the dentigerous cyst ka lining epithelium or from the rest of odontogenic epithelium. The second complication is development of epidermoid carcinoma. Here also source can be from the epithelium. And the third one is mucoepidermoid carcinoma, which is a salivary gland carcinoma. The dentigerous cyst also contains mucus secreting cells. So this can be the source of mucoepidermoid carcinoma. So whenever a surgical excision of the cyst is done, we should always be careful that it is completely removed so that the possible of recurrence can be avoided. Now coming to the treatment, if it is a small cyst, we can excise the entire lesion. Marsupialization can also be done, and the extraction of the impacted teeth should also be done. So this is what I tried to explain about the dentigerous cyst. If the video is informative, please press the like button, share it with your friends, and please subscribe my channel.